Yes, Excel.
Good. And for this, I'm very happy to present Jenny Karlbom. She will be moderating this. She's working for migration and health in Region Skåne, and as you heard, field worker. And Anna-Lena Eriksson just coming back for a few months ago from Lesbos. And Alice Petrén, the Swedish radio's correspondent on migration. I'm very happy to see you here, and I'm very happy for your patience. That you have been here for a while too.
Not worry, not worry.
So thank you. I will leave it over to you then, Jenny.
Thank you so much, and thank you for asking me to moderate this evening. I just want to say some specific things about Lesbos before we start. Is everyone aware about the current situation in the Lesbos island? Yes, I see a thumbs up. Okay. So as you know, the situation is quite difficult, and it has been for a very long time. Now, the Greek islands have been a little bit of a hotspot within, it's been like a hot topic within the EU migration politics. So it has drawn a lot of criticism. It has drawn a lot of right-wing activists to the island, actually attacking both refugees and asylum seekers. And it has also drawn some activists, quite some activists, who are trying to actually help and facilitate the situation for the asylum seekers on the island. But the main issue remains that people are basically stuck there. They don't move on. They're not allowed to move on unless they often, very often, it is because they do that themselves. So they choose these dangerous roads with traffickers. And that is if they have the means to actually pay someone. So we are in a situation where I would say that the European Union, basically, no one wants to solve this situation. What we have seen during the COVID-19 crisis, the corona crisis, is that some people who are extra vulnerable or for different reasons, they have been moved to other places. But why is it so difficult to reach a solution or to try to actually implement a situation where this big group of people are suffering in Europe beyond what is reasonable, given the means that the European Union actually have? Before we start the discussion, I also want to raise a point, and please, Peter and Anna, I'm gonna let me know if you want me to stop or if we shall move on, but I just want to raise a point. So the information that I have had is that in Greece, the migration department has designed an emergency plan in order to prevent the coronavirus from spreading. Now, most states with a Ministry of Health that are having a health plans, they have implemented an emergency health plan. I also work, as you heard, within Region Skåne, developing the issues of migration and health. And we are working very closely on these topics and following up the COVID-19 pandemic in Sweden and what Sweden is actually doing to stop it from spreading among migrant groups. So the migration department in Greece has done the same thing. Still, the Greek authorities stopped the MSF Corona Clinic, even though they had their own emergency plan in order to try and stop the virus from spreading. And what does this tell us about the politics within migration issues in Greece? It's interesting that maybe not the same authorities, I don't know, but the public authorities are actually trying to implement a plan to stop the coronavirus from spreading. And then again, they are stopping MSF. I think we shall move on to listen to Anna-Lena. Am I right? So Anna-Lena, you just came back, and we would love to hear your experiences and what you are thinking. Now, I hope my little introduction maybe that gave you some clues on things I hope you could develop a little bit.
Yeah, sure. I'll put together some pictures from my mission. I got back about 3 months ago. So I want to show you, like, it was a quite difficult time. But I will show you the pictures, and then you can, of course, ask me as well. So might be not be in chronological order, but yeah.
Anna-Lena, tell us how long you were there.
I was on Lesbos from March until September.
Okay, thank you.
Yeah. So, can you see this now? Good. Okay. So I left Sweden in March.
Anna-Lena, sorry for interrupting. If you can just put it on presentation mode, the way that you did when we did the test.
Sorry?
Presentation mode.
Oh, yeah, it is. It's not that.
It's just you have to go to the, I think, left corner down, and then you have 3 icons, and then you click on the one to display the presentation. I guess the one, not that one, but the one that, yeah, no, thank you so much.
Okay, great. Okay, so I arrived in Lesbos in March when it was still very cold, and I was 2 weeks late because there was a lot of fights and protests going on before I came, and then Greece went into a lockdown, and also Lesbos was in a total lockdown. So this is mainly what it was like: empty streets, everything was closed down, and everything, you didn't see any people, and all the fights and protests stopped. And I was in quarantine for 2 weeks. And then I had a very, very difficult start on my mission, because I was working in the pediatric clinic. It's just opposite from Moria camp. This is what happened on my first day. There was a big fight inside the camp. And this was also going on all summer, because there was so much frustration inside the camp. So we had this mass casualty my first day. So this was very shocking. When I arrived to Lesbos, it was 20,000 people inside the camp. So to hear the noise of all these people fighting and then coming into the clinic was very, very overwhelming for me. But then I continued to work in the pediatric clinic. The children I met all had symptoms and illnesses like directly from, like, with symptoms from the camp. So lots of severe scabies, infected wounds. They were coughing, lots of children with asthma, and also rat bites. Lots of parents were very, very worried about the children, because they started to bedwetting again. For me, it was super, super difficult, because there were so many children with really bad burns. Sorry. So I still remember this father coming running down from the camp with his girl in his arms. And she just had boiling water all over her legs. And it was so cold, and we took care of her, of course. her mother was crying and the baby was crying, and it was super difficult. So it's a really hard memory for me that I will never forget. So, and this is a picture. We had also children coming back to us every week to do the wound dressing. And because of the COVID situation, we didn't have any cases at this time in Lesbos, but we were still dividing the clinic into two parts, like the suspect, the blue zone we called it, and then we had the clean area. So if the children was coughing or had any symptoms of COVID, we had to take care of them in the blue zone. So this is from that part. So it was also a difficult time because the parents were very frustrated, and also like it was a bit more easy early in the day, but the needs for healthcare was so big. So later in the afternoon, we had tickets first in the morning, but then we had to send a lot of children back and ask them to come back to us the day after, and give them cards for coming back. And we also was promoting for hand washing and keeping the distance because of the threat of the COVID-19. And I didn't understand in the beginning that it was, I didn't know the word overcrowded before I entered the camp for the first time. I put these pictures together also for you to understand the contrasts that you see every day on Lesbos. You have the beautiful island, and then when you arrive in Moria, you have the camp and all the people. We also have mental health in the pediatric clinic, so lots of children coming to see the psychologist. Yes. So first time I went into the camp, I realized the word crowded. So it was, at that time, it was about 1,300 people for one tap of water, and about 250 showers. So it was not enough at all. And to get food, you had to stand in the food line for 3 times a day, and it was a lot of hours and a lot of queues. So keeping the distance was completely impossible. So yes, and also in the middle of the summer, we had about 37 degrees. So it was super, super hot, and the garbage was like, they didn't collect it. So the smell in the summer was really horrible. And the tents were like on top of each other, and some areas were more crowded than the others. And then there was like lots and lots of sections. And it was 3 types of places to stay. So like the summer tent when you go camping, and then you had the construction where what you can see in the picture, like you put together whatever you can, and then the iso box, like a container looking construction. So yeah. During this time, in the middle of, like in June and July, there were still people coming to the island, and they were put in quarantine in the north. And then they did testing upon arrival when they came to the island, but then they mixed people together, so the quarantine was just taking a lot of time. But we still didn't have any confirmed cases on Lesbos. But then Greece opened the borders and numbers were still a bit low with COVID. And I think no one believed the coronavirus would actually come. So it was still a bit slow with that. But then in June, I changed, so I started to work for the COVID team, and we opened this isolation clinic to be able to monitor the camp, so to do testing of COVID, and also to be able to isolate people. We had doctors, nurses, we had the psychologists, we had health promoters. So I think we had a really good thing going on. We could also, we didn't force anyone to come to us, so everybody came through the central triage. But in the beginning, we had a bit of trouble to get patients because there was some disagreements with the regional doctors. But then I think we had about 4 to 14 patients admitted per day. And this is part of my nurse team. So we did the testing, and then the hospital helped us out with analyzing the tests. And at this time, I think this was the only staff in Moria who knew how to do the testing and how to use the PPE and everything. All the time when we had this clinic, there were still lots of protests, and I think the fear of COVID started to rise a bit because the borders opened, and then there was a few COVID cases around in the villages, but they still managed to isolate these people, but it got a bit closer. So we had the possibility to, we had kind of we could give oxygen, antibiotics, and IV fluids. And then we had, everybody had their own room with nice beds and toilets and showers. So it was very nice because lots of our patients were very happy to have some rest in the isolation clinic. So I'm happy we didn't have any positive cases during this time. But then there was some legal issues, like you said, Jenny, and we were forced to close this clinic down. And in 3 days, everything was dismantled and gone. And it was very, very frustrating because just a few weeks after, we had, they opened a hospitainer, and this is the protests. I borrowed this picture. So there was a lot of protests going on. And from now on, there was like, it started to be very chaotic, I think, this part of my mission. And we didn't have the clinic anymore, and there were no place to isolate if there would be a confirmed case. So this is how I felt, and I think also my team felt like this because it's been challenged every day to keep this clinic open and to run it because there was just very difficult with the authorities. And also when the cases were rising a lot. Also during this time, this is from the life jacket graveyard in Lesbos. There were no more arrivals on the island, and the few that came down from the north was a lot of stigma inside the camp as well, so they were not welcomed into the camp. There was more roadblocks. The lockdown they were like prolonging it every 14 days, but on the rest of Lesbos Island, everything was open and people were just starting to live as usual. So there was also a weekend when a lot of people went, there was big gatherings, and after that we had like COVID cases was going really high. I think it was more than 100 in Mytilene city. And then we started to do some other activities because we didn't have the isolation clinic anymore. So I was going into IPC training, infection prevention control. So we helped out with other NGOs to because no one was really prepared, so it was very chaotic. So we started to help out how to use the protective gear, how to rebuild some of the clinics to make a better flow for the COVID cases and the symptomatic people. Still no cases inside the camp. But then one day, just a few weeks after we closed the clinic, the first case came into the camp, a man. They decided to isolate him and his and two of his closest friends in a place really far inside the camp. And this area was no electricity, no nothing, it was just shelters. And my last working day, I was supposed to go there to help out because there was a volunteer group that was told to take care of the people who was isolated there. And every day it was just more people put into this place. And I talked to the team leader and he asked if we could go in there in the camp to do the training there. And then I talked to the project coordinator and was just too much going on inside the camp, so we could not go inside. And I asked him if we could do it another day. And then he just told me we have to decide later because it's 25 more people now coming. So it was lots of people going into this place for isolation. And I went back to Mytilene city and I had my goodbyes with my team. And I flew out in the morning to Athens to do my debriefing. And then later in the night, I just went to bed exhausted because I was flying back to Sweden in the morning. And 3 o'clock in the night, these pictures came on my phone. Some of them, it's Ehab looking at the flames of Moria camp. So I wish I had a better ending, but this is the end of my mission. So yes, thank you.
Thank you so much, Anna-Lena. And I can definitely tell that it was very moving for you having to go back and revisit these memories as you spoke. So thank you again for taking your courage to actually speak about it. Was this your first mission with MSF? Yes, this was my first mission. So it was, I'm very glad I did it, but it was a bit harsh ending of the mission. It seems it probably was very harsh throughout because you were in a very difficult place. I also just a reflection. I think it can be harder for us who live in Sweden. We have this perception that Europe will be better than most places, caring for people who are sick and vulnerable. And when these ideas are sort of, just turned around, that can be very, very hard for yourself. It's easier to distance yourself a little bit if it's in an area of the world where you might not have the same expectations. And part of our work is to actually speak out. So what you did, you and your colleagues did on the field was very important, even though you had to shut down. But what you are doing now, I would say, is also very important, if not as important, because you are actually speaking out for MSF. And it's a very good thing to do. I want to see if anyone else has questions to Anna-Lena, but I just want to ask you myself, could you see the direct results of your work in the camp when you were there? Could you actually see that the medical relief was being provided, or how did you feel about that?
It was a bit divided feelings, because I felt very good, like when we were able to take care of the children in the pediatric clinic, we had burns that we could heal, and we could see good results with wound care. We had also children with diabetes, and we could help them. We had the chronic children with different diseases that we could give medication and all these things. But it was also very horrible to like chickenpox. Everybody had chickenpox, and it's you cannot do anything about it. We could only give paracetamol, but it was so horrible to just send them back into the camp, because the child here, maybe you go back to your bed and you can have some ice cream, but going back to that camp, and children were so afraid because they were living in tents, and there was so much violence going on. And I had a colleague whose best friend was murdered over a phone. So inside the camp,
was that one of the medical staff?
No, it was a CM, okay. A cultural mediator helping with
okay.
was living in there. And then for the COVID clinic, we had a really good thing going on, because lots of people of course it was good that they were negative, and we could actually give them really good health care, because sometimes we just had few patients. So I think we gave them like a lot of health care, and they could see the psychologist, and yeah, it was nice that way. But then when we really needed the isolation clinic, then we were closed. So
and that is something that it must completely just take the breath away from all of you who are working so hard. And I think this is a very interesting perspective on the Greece politics, that they are actually doing this. But if we check historically, this has happened previously. We have had people being marginalized historically, put in certain camps, put in certain areas, and they have been neglected and robbed of their basic human services for human needs. So it's not the first time, but the question is a little bit on a higher level. The question is, like, how can the powers for humanitarian aid or humanitarian conduct, how can the positive forces actually try and tackle this? Like, how can we tackle this with the Greek authorities? But it's a little bit on a higher level. And I really, just because I think we have people who are really curious about what you spoke about. So I want to just take a few minutes to give you people a chance to actually ask Anna-Lena a few questions. Jeff, I can see that you're raising your hand. Would you like to ask her something?
Yeah, forgive me if my information is old. I read about the clinic being closed, and then read about the fire. And my hope was then that it might give an excuse to reopen the clinic, which my feeling was it got closed over political disagreements. And I was wondering if that was an excuse to reopen the clinic. Do you happen to know if that ever happened?
No, the isolation clinic was never open again, but I know Bettina can maybe answer. The regular project is still going on, but I'm not sure exactly how they are doing the activities now. But the isolation clinic never opened again.
Okay, thanks.
For what I know. So, yeah.
And thanks for your presentation.
Thank you.
So Jeff, would you take down your hand, please? Just so that I can see that. Yeah, great. And now we have Linda who wants to raise a question.
Sorry, a bit delay in all the unmuting and clicking. Thanks, Anna-Lena, for your presentation. I'm also here because, I mean, this is a context that's got a lot of interest also in our home countries and good in a way. But I think, of course, for example, in Finland, I mean, we've been trying to keep an attention on this and also on how unacceptable it is. So I think there's a general agreement on that. But I'm really curious of maybe you can't answer so much, but exactly this, we do talk about the Greek authorities, but I also assume they're not like a monolith that act in a certain way, that there's also dynamics locally that affect this. And really, you know, it is frustrating, I think, as humanitarians, when you just try to do your job and you're blocked. And definitely the COVID isolation center closure was really hard. Like even here, we're like, like what happened? Like why? And I mean, I even gave an interview saying, okay, they used urban planning, but you have 20,000 people in a space for 6,000. So, I mean, it's so absurd. And I can't imagine how it is being there in that absurdity and trying to do something. But did you see anything positive as well? Because I've also heard, I mean, and we've done in our home countries a lot of advocacy towards our own sort of EU member states that do try to do decision making, and everybody's sort of listening, but very little action, unfortunately. But were there some positive aspects as well? You know, did you see, I've heard about some of the children that were transferred. So yeah, just want to ask
Okay,
you that.
I'll try to be positive. Yes, there was people transferred to mainland. Then I'm not sure what happened in mainland, but I know one of my patients, a very young 17-year-old diabetes patient, I know she was transferred to Athens to continue her healthcare in Athens, which was like I was super happy about this. And there was a lot of people being transferred, and we were doing like a lot of advocacy because to transfer elderly and also risk groups from the camp. So I think they managed to empty a lot. There was still a few hundred left, I think, when I left Lesbos. Yeah, so there was a lot of work done like that. Yeah.
You're muted, Jenny.
Sorry, that must have looked really stupid. We shall now, thank you so much, and we shall now move on to Alice, and we will have the possibility for you members to ask more questions to Anna and Alice as well. Whenever, when Alice has finished her presentation. So, Alice, I would want to know if you would like to present yourself.
Well, I am a migration correspondent at Swedish Broadcasting Radio. I have been that since December 1, so I'm actually celebrating 5 years today. I was putting up a video on my Facebook site from Izmir on the other side, on the Turkish side, where people were leaving at the time in thousands, actually. Before that, I've been the South European correspondent for almost 10 years. I'm in Paris right now, sitting in my apartment in Paris. And well, I've been with the Swedish Broadcasting for a long time. I've been with the UN and been doing various things during my career. Thank you for inviting me. I have been also quite a lot to Lesbos. My first time was in February 2016, and I've probably been back like 8 times, 9 times, renting cars, traveling around on the island, and hanging around quite a lot around Moria, as it was before it was burnt down. Thank you, Anna-Lena, for very strong pictures. Since I haven't been there, I went there in February, my last time, just before the lockdown, actually. And since then, I've been checking the possibilities. I checked today because I was thinking it's really time to go and do a follow-up on how people are living before the winter, and with the new camp. Moria has been changing quite a lot over the years. I was there in February 2016. March 18, there was an agreement between European Union and Turkey, which changed everything. In the morning, March 20, I was at Lesbos, back at Lesbos. I was in Brussels for that night between March 18 and March 19, and left immediately for Lesbos to see the effects of that agreement. And there were a lot of, there was the military camp, and there was also like a free camp outside, which did grow over the years. Just before it burned down, there were like 20,000, and a lot of miners also, like you were talking about, Anna-Lena. There was a lot of miners, 1,500 estimated miners at the end, actually. It changed over the time, and from the beginning was a lot of Syrians, of course, and a lot of Iraqis, a lot of Afghans, and then suddenly there were a lot of black people from various African countries, and it kept on changing. The restaurants around the camp, in the beginning there was absolutely nothing, and then suddenly there were small restaurants and marketplaces, and you could actually almost walk into the camp freely. It wasn't possible for me. I did try it once, but I did go with some organization in to see what it would look like in a car, like hidden. But I never got the permission to enter the real camp as such. I'm saying this, that this has been there for a very long time, because many of those who actually came at the beginning, came in the spring 2016, are still stuck in Greece. And the asylum procedures are extremely slow in Greece. And I was trying, when I was listening to you, Anna-Lena, I was actually trying to see which year it was that the European Court was saying that Greece is not good for any reception or any accommodation of asylum seekers. The Dublin Convention, which means that the first country you come to, you should also be sent back to that country. That's been the rule within the European Union. Greece was not, it wasn't possible to send back to Greece actually after that court decision, because conditions were so bad in Greece. They were seen so bad. And I think also the Greek authorities meant to have them bad because they didn't want people to stay. Like Italy has always been sort of very open gates. They let people come, but they also let them continue up in Northern Europe. Spain is a bit different, but Italy and in particular Greece also, the conditions were very, very bad it's always been actually. But with that agreement, and also with a decision in end February 2016, just before that agreement, Austria took the decision to have a maximum a roof, you could say, only 37,500 asylum seekers per year, which meant that very quickly, because there were so many people coming through the Balkans up to Austria, and they closed the border and just let some hundreds enter each day, which closed the whole Balkan road. I think it's important to remember all these things, because that closed the Balkan road, which means that Greece is now, they have over 100,000 asylum seekers in the country. And a lot of people are stuck in various camps in Greece, in Athens, in Thessaloniki, and around the country actually. And people are of course trying to pay smugglers to get out. I've been following an Afghan family, and from the beginning they started to send off their 11-year-old son to Germany and they managed to sort of, but it's a split family today, which is also common. And who actually came over the waters also changed over the time, because a lot of families would come, and more families would come even after the decision, since family reunification became more difficult in Europe, for example in Sweden. So they will travel together. It was more deadly actually to go from Turkey to Greece in that way. I think it's important to remember that Greece, they don't want to have the asylum seekers. They had bad conditions before, and then now they have all these asylum seekers there. They feel that the European Union is not thinking about them, leaving them with all this to handle. And that's why I'm working on a story for tomorrow morning for the news, because the European Parliament had a hearing today with the Frontex, the boss of Frontex, which is the police, the border police, and he was answering questions if there has been pushbacks, which means illegal pushing backs of migrants to Turkey from Greek water. Of course there have been. There are a lot of pictures of boats coming, and these dinghies are in waves and so forth, or they are shot at, or they shoot around in the water, so they get afraid, or they actually several times they have been taken from dinghies, and then the Greek authorities have been putting them back on the dinghy, which was possible to sort of put them on and then pushing them back. So there has been a lot of incidents of that. And today there was a hearing in the European Parliament. They were very mistrusting, and there are a lot of questions to this Fabrice Leggeri, who is the boss of Frontex. And the European Commission is asking questions, of course, and it's a story to be continued. But I think we have to remember what's going on now in the waters. And maybe to finalize, because I'm not going to talk that long, is also that Ylva Johansson, the Swedish Commissioner for Migration and for Interior Business, she's been proposing, it was September 23rd, she was presenting a proposal for a new migration pact. And one of the parts in that pact is that there should be a quick screening at the border, which should be done in 5 days. And you could then say that this person has no right to, there are no need for asylum here, or this person may have a right, and divide them into 2 groups, and then try to send them back as quickly as possible after 5 days already. Everyone who has been in Moria or elsewhere, I have been in most of the spots. I've been in Lampedusa many times. I was in the Gran Canaria from 2 weeks ago, which is called the new Lesbos now, because there have been like 18,000 coming very quickly to Gran Canaria, which is a small island. But they are no, I'm sorry, I lost my thread here. Yes, no, Italy and Spain and Malta and Greece are all telling Ylva Johansson that we are going to be stuck with big camps. It's not possible. They realize, they know how it is in practice, that it's not possible in 5 days to send anyone back. So they realize that they are going to be stuck with many Morias, which they don't want. And Anna-Lena, you know from Lesbos, if you have been to Lesbos and talked to people there, from the beginning they were very friendly and very open-minded, and in the beginning when we came there, everyone wanted to help out. And I went around and talked to families, made stories from families in Lesbos, and the kids were friendly and supported their kids. And that has turned quite a lot. And although they are saying that they are losing tourists, that they're not earning enough money, I think that's a fake thing, because they get so much money of all these people like me and you and Frontex staff, etc., coming instead of the tourists. And we spend probably more money, actually, like journalists and Frontex staff and others. We probably spend more money than the tourists. So I think they are not losing. But it's been a very big change in the atmosphere on Lesbos during these years, which means that Moria, which is like outside the town, Mytilene, It's like in the middle of nowhere outside the town, actually, along the road. They can just leave it there, actually, and it's going to be left there, actually, I think. And that's what Greece and Spain and Italy and Malta, they realized that the proposal for the European Migration Pact, that's the part. Europe is not going to give so much more money to Turkey unless Erdogan is really threatening even more. But European Union has been very, very slow in answering on threats from Erdogan when he's been threatening to open borders. He wants a visa-free situation for Turks, which has not been, which was in the agreement of March 2016, but it's not been put in practice. They still need visas, which is the main thing actually for the Turks. So this migration pact is not only Orban and others saying no to it, it's also many other countries saying no to her pact. So this is going to be complicated for Europe. I think I stop there and I am open to questions.
Thank you so much. Yeah, can I? Yes, okay, so I think all the microphones are closed. Thank you so much. Great to hear your perspective, Alex. And I want to ask a question to Alex before we will just raise another small point. Let's see, we have a raised hand. Peter?
Yes, thank you very much for both of your presentations. Very interesting to hear. I think most of us have worked in refugee settings at some points, and what we hear, us who has not been on Moria, is that it's the worst, lowest morale there, or the less hope there. I mean, even if you're in a setting in Sudan or Somalia, where I have been, you don't hear that much of depressed people. You don't hear children hurting themselves and such. So it seems to be some mechanism there that makes it especially hopeless. Yeah, that was a reflection. Maybe if you have some reflection on that. And my real question is, are there any signs of this situation discourage people to come? Does it have a pushback factor effect on refugees coming, or I mean, I can imagine that would be a desirable outcome. Absolutely. If you really treat people bad.
I can on your last question, it's full absolutely. That's also why the Greek authorities, of course, are pushing back people, keeping very, very, very low standard in the camp. So that's going to be no pull effect at all. No one should be attracted to come to Greece and try to come to Greece, and they do anything to actually make people not come. Yes. I think Moria, why it's depressing is maybe because you can't get, you cannot come proceed. So it's difficult. You're stuck on the island and you can't do much on that island, and the conditions are very poor. You are sleeping on the ground. The tents are your own little camp, your own little tent from like 3 persons, or you share a big tent, which maybe UNHCR have provided. And then you are like 3 families in the same tent. So you have like 1 square meter or so for, you have absolutely no space. And there's also a lot of violence. For some reason, it's been fairly violent the whole time, but queuing for food, queuing for the showers, queuing for things. I've been talking to women, they're saying that like we go and pick up the food because otherwise our men are going to come back, being stabbed or hurt, or there's so much tension because they cannot proceed, and they realize they cannot proceed, and that their chances are like they're going to be stuck there. They're not even sent back actually in another direction. So they're sitting with big eyes and just wondering, there's nothing happening. And the asylum procedures are very slow. I think conditions when UNHCR and others are, like I've been to camps also, it's more organized. It's more, this is so unorganized. You just put up your tent. Moria is military camp. So that's where you have like more organized tent. And then you just set up your own little tent out in the nature, close to that. So you can go into the military camp and get your food or go to the showers. But it's a long way, it's dangerous way. And if Rohingyas, for example, in Bangladesh, I've been many times to those camps, and I mean the authorities are in there building roads, building channels for the water, sewage systems, setting up new things. It's like things are, you realize they're going to be stuck there as well, but then they also realize that they are things, the conditions are improved, but not here. It's no. And the staff, like the Greek police, are very rough. Many of them are maybe members of a party that you don't want to be a member of, so to say. The right-wing party.
Yes.
Thank you. Peter, can I move on and give the mic to a few people who have questions? Is it okay?
Yeah.
Afamia, you had your hand raised. Would you like to ask Alice a question?
Yes, I would. Thank you both for sharing your stories. I have actually a very big question. Maybe you can see if either of you want to try and answer it, but what is the solution for Moria? How to get it closed? How to get those people to get to a better situation?
I think it's up to you, Anna-Lena, because I'm not the one giving advices how to do this. I'm not a politician. I'm not an activist. I'm just a journalist reporting and trying to cover things. So I think, Anna-Lena, maybe you have an idea.
No, I don't. I have no idea. I just wanted to follow up on what Alice said, that during the summer when I was there, they were just trying to do everything more and more difficult. Like they put in an ATM that was not working. They changed, you could go to the store, like they let 100 people out every day, maximum, to go to the supermarket, but then they changed the credit card, so you could not pay with credit cards anymore. You could only buy food from this card, and then they used the COVID lockdown as an excuse. I don't know how to answer your question, how to get people out. It's just you stand in a line for everything, and even if you're gonna go to the YASO to get for the asylum, for the interviews and everything, sometimes the police didn't even let people inside the RIC, and if you miss your appointment, then it's out. So then you have to wait for months to get the interview again. So yeah, but I don't know how to close Moria. Sorry.
Thank you so much for the question, and thank you, Anna-Lena, for responding.
Maybe I should add something. I think if you want to work on this, it's on a European level, because Greek is certainly, and they have the government, they are actually elected on not getting in immigrants. So they are actually doing what they said they wanted to do. Mitsotakis is a right-wing politician, and that was he knows he has to balance between even more right-wing party and the left. So he's doing what he promised to do, and have less immigrants coming, and so that's what he's doing. So why is Europe accepting these conditions? That's more on a question to maybe how can you make Europe say that this is not okay, because everyone knows it's not okay. Everyone is shocked who is there. Everyone sees how terrible it is. And they have all been visiting and saying, like, you know, oh, we're going to ameliorate this, but nothing much is happening. And because the voters, they don't want much change.
Thank you so much. We have another question from, let's see who it is. Is it Linda? I think it's Linda who has a question, who raised her hand.
Yes, but if there's anybody else, I can wait because I've already asked questions.
Go ahead, you ask, because then we will move on.
Yeah, I think there's a lot of Mia's question. I think it's the $100 question. And again, for somebody like here who's been trying to do advocacy on EU member state level, I can say we're only very frustrated. I think MSF been trying to cry out for this for 5 years. Without very much results. So yeah, I think it's really problematic. And as you say, the local Greek situation has no incentive to change it. But to be honest, it seems very few European member states have really an incentive, because it is about, you know, just, okay, let's just deal with the problem somewhere else, and we don't have to deal with it. We see the same with Libya and search and rescue. I mean, it's exactly the same arguments, like the pull factors being used. Even there's been research being done to show it's not the pull factor that influences these population movements. So unfortunately, yes, that's what we're seeing. And what MSF has been trying to do is kind of call it out and a bit of sort of shaming, but we're not really seeing very much impact. And we do know also the EU politics is quite complex. I wanted to ask, I mean, I think I was interested in the Greek perception, but I think, Alice, you kind of explained it a bit. But I mean, what about, UNHCR, the UN agencies, the ones that normally in these situations would have a responsibility as well? Do you have anything to say on that? Because indeed, it is a strange situation where probably many of the normal humanitarian mechanisms work in a different way in a different setting, and now we are in a European state. So I don't know if you have any reflections on that. I know there's a sharing responsibility between UNHCR and IOM, but it just seems they are, and many organizations are quite silent.
You know, UN agencies, they don't take any government in the ear. You know, they don't pull them in the ear and say you're doing something bad, because that means that you will not get any funding. So that's not their job, actually. They don't find it they don't have that position, I would say, to actually. So they always go on the diplomatic side, on the cooperative side. So that's where you would find them, I would say. But I think that the only way things will change maybe would be a legal way, maybe. I was thinking of, because there was before in the European Court a decision that the Greek conditions were not good enough to send any Dublin cases back to Greece. That was not possible to do because the conditions were seen, and the court said that they were not good enough. You cannot do that. So maybe I don't know. I think you have to go on legal ways, and I think because there is a legal right to seek asylum when you are on Greek water or in Greek land, and you are denied that and pushed back, that's illegal. You have to go on the legal side. I think that's the only way you can actually. I don't know. I think that's the only way you can do it. And of course, they feel guilt, but that's not going to help. The Canaries is the same now. There are a lot of people there, and they are being sent back to Africa because many of them are not. They don't have any need for asylum. They are also corona victims, you could say, because they lost their incomes, they lost their positions, they don't have any money, or they have money enough to just pay the trip, but not much more. So they are escaping. They foresee a very bad economic situation for themselves due to corona. That's why they are leaving, according to the Spanish government.
Thank you so much. And I know that we have Tina with us, who has worked as a project coordinator in Lesbos. Am I right? Tina Dahl, are you there? No? Okay.
Yeah, she has just unmuted herself, but I think she has sound problems. So maybe we can go.
I can see
further, and then Tina comes back if she manages to speak.
Of course. So Tina, whenever if you want to speak, and if you have been able to sort your microphone out, you can just raise your hand, and I will notice it, and we will switch to you. Okay? Yeah.
Hello? Can you hear me now?
Yes, we can. Perfect.
Okay, let's take off my, maybe it's my earplugs. Okay, so let's see. I'm sitting with my phone here in the kitchen.
Okay. Most
Okay.
welcome with
Yes.
your Tina, tell us, have you been working as a project coordinator in Lesbos?
No, I'm the nurse activity manager in Moria Clinic.
Okay, great. Then we got it right.
Yes.
When did you come back?
No, I'm here now. So I'm in Lesbos now.
Oh, okay.
Yes.
Perfect. Great.
So
Go
I came directly after the fire. Probably when you went home, Anna-Lena, I arrived. So it was very interesting to hear your story. It gives me a lot of background for sure. So I have been here now for 3 months. And Moria Clinic is still ongoing, but it has changed a lot for sure. So they opened the new camp, Karatepe, and for now there is 7,300 people, and there have been some they have I lost the word. Not transport. They have transport people to the mainland, and of course, some of them are also in Germany. So I think 7,300 for now. And for sure, Moria Clinic has changed. It's 5 kilometers from the camp now. So from the first weeks, people were walking to us. And then we were starting to drive the patient with our own vans. So we worked a lot to help the people to come to our clinic. So then we have worked on medical strategies. A lot of change has happened. Before you have all these children, the pediatric clinic was opened. It's closed now. We have handed it over to EOD, CMA. Have the chronic cases, our children now. So we are only running SRH and mental health for children in Moria. And for now, we have a big bus going between the camp and Moria Clinic. So it has changed a lot. And we have also closed the blue zone now, so we are only working in the white area. We did that last week. So small changes. And Mytilene Clinic is running as usual. Yes, the condition in the camp, the last weeks, we can see an improvement. There is a lot of medical actors, many actors. First, we have a Norwegian team coming, EMT team, sent by the European Union. They stayed here for 6 weeks. And after them, it came German teams who are here now. They will stay for 8 weeks, and everything is about for them trying to hand over the medical to EUID, who is the governmental organization here, the government hospital. So they are also in the camp, and there is many NGOs inside the camp. So what I understand, it was a kind of choice after the fire, if people should go inside the camp or not. And many decided to go inside the camp. And MSF, we are outside, of course, but still we have HPs going into the camp and are helping our patient and do health promotion as usual. But we decided to close the pediatric clinic in Moria because there is a lot of other actors doing this inside the camp today. So the Red Cross is here. They have opened up the mental health for children. We have also, just last week, I heard 10 psychologists were...
your sound is not super, Tina.
It has been improved. And also the facilitates has improved. for now, last week, the shower started. It takes some time, but there is 110 showers now, still cold water showers, and they need to fill their buckets with 20 liters water, and then they have some kind of arrangement so they can shower in this water. Before they could only shower in the sea, bath in the sea and wash them in the sea. And there are 345 toilets, very dirty, so it's very hard for them to use them. But they had a kind of winter isolating the tents, most of them. And they have started to, I think probably the most of the electricity is finishing now. And also they have the sewage is finished. So we can see it's improving. It is improving. It is very, very slowly. And they are also starting again to try to teach the children. There are some NGOs collecting children and are like teaching them on the spot, Greek language and English language. And they have also a kind of basket playing, and some for the kids, they try to do things for them. But it's lockdown in Greece again. So the camp has been locked down now. This is the 4th week. And they can only go out from the camp with appointment cards to doctor, asylum interviews, or to lawyers. So for sure, it's hard. And they are not allowed to, cook food as in the old Moria. They could cook themselves. They are not allowed to. There are 2 checkpoints, and it's hard for them to come out, and so for sure it's not easy. But there is some more safety inside the camp. We had our comms from Athens. They were here last week, and they were interviewing 2 female and 2 male from inside the camp. And when I was talking to Dora afterwards, she said it was single men, and she said there is a difference, because now we have more safe spaces for the women inside the camp, and they told them that it's not good in the camp, but at least they feel much safer. But the single men, they was direct the opposite. They feel very, very unsafe.
Tina,
and there is
and I'll just ask, because it's super interesting what you're saying. I'm just a little bit curious to come back to the authorities. Like you give us a picture that's more optimistic. It sounds that it's more organized. There are more things in place. There are actually different kind of necessary activities, even activities that might be beyond the most basic human needs, such as activities for children. Why this change? What do you think? Like, have you any idea how come the situation is right now? Because it must imply there's some sort of change from the authorities.
Yes, it has. It is like the organization is like that. EUD, they are like the umbrella. So everyone medical actor inside. There is UNHCR, I think they have improved, and also WHO are inside. So every week, all of the medical actors, even MSF, they are inside the camp. They have this medical meeting every week. They try to see the gaps. We try to help each other to have the best medical service. But still, when we were talking about this, what to do or not, I think if you are going inside the camp, you are also like, the EOD has the power, and it's not easy to act, because if you are doing what you want to do, you are out in a way, because they are the ones you have to go through them about everything. They are telling us all SV cases, they need to go through EOD, but for sure it doesn't, because the other actors are calling us direct, but they want everything to go during them. But that is a hopeless situation, because, it doesn't work. The governmental healthcare doesn't really work. No.
No, and I mean, it's perfectly clear, because otherwise MSF wouldn't be there and WHO wouldn't be there. There's a great need for external medical actors to actually be inside and offer their services. I still think it sounds positive to hear this a little bit change in the approach. I don't know, it would be interesting to hear what everyone thought about it, but we are a little bit limited on time. I'm just thinking if the corona situation has put some pressure on the Greek authorities. I really don't know. I just think it's an interesting development, and I think MSF should definitely monitor it a little bit to see where things will be going. But still, no matter how the authorities are actually working with or against us, it's very important that MSF are still there.
Yeah.
In a little while, in a few minutes, I will give the word back to Peter, but
May I just say one thing, Jenny, that Alice is writing that she has to leave. So just officially, thank you very much, Alice, for coming. It was very interesting to get your input.
Thank you so much for inviting me. Thank you so much. And I'm so grateful to you, Anna-Lena, telling me during the summer how it was. And Tina, I would be very happy if you could mail me your mobile number, so I could actually make a piece for the radio, how the situation is today, since lockdown is until December 7th, as far as I understand. Bye-bye. Thank you so much. Bye-bye.
Thank you. Bye.
Thank you very much.
Thank you for notifying me on that, and it was great to hear Alice's perspective as well. Do we have any more questions to Tina before I will give the mic over to Peter? Anna-Lena, you're raising your hand?
We had also a question from class, but I don't know if it was for Tina or for Anna-Lena or for.
Yeah. So who wants to start? Klaus, do you want to start? And if you
no, I actually had a question for Alice, but she's gone now. It's fine.
Okay. How, Anna-Lena, you wanted to say something?
No, I was just thank you, Tina, for telling about the situation now. I'm still in a bit of tears here, but yeah, say hi to everybody. And
Yes,
yeah, thank you for sharing. Yeah.
Thank you.
Yeah.
And Jeff, you had a question or something you wanted to say?
I was wondering if anyone has a sense of EU's position on Mora. I mean, Greece is into EU for something like 100 billion euros. That would seem like a lever where I come from. I don't know their position, but it seems to me if EU is not willing to take migrants themselves, maybe they're willing to bribe Greece into doing a better job. Anyone have any thoughts on that? Linda, you look intrigued.
Yeah, well, I can kind of just comment because it's part of what's now the Migration Pact that's being developed, which is supposed to be an answer and a new, fresh start of and I think MSF as such, as far as we've been doing advocacy here, it's a big package, involves a lot of aspects. So MSF doesn't have a position on the whole, but our analysis is it's the same thing really has been going on. It's about externalization of the responsibilities, whether it's Libya, Turkey, or Greece, and that's just going to continue. And it's for sure some new aspects, like it was mentioned before, the quick screening, but there's a huge problem with that. And search and rescue as well, saying NGOs shouldn't be criminalized, but I mean, we don't really see. It's a lot of nice words, and yes, I agree with you, Jeff. You think they would have a possibility to pressure, but I think that's not where the problem is. The problem is the EU as such, as an entity, is not really willing to take its responsibility. And it's also because it is the mechanisms, the way it works, and you have countries like Poland and all that. I mean, yeah, they're stuck. And I know this because we've been talking here to the Finnish government. There's domestic politics that gets involved with this. There's European politics. It's a really messy game. Sorry, that's my short analysis of it.
Exactly what I wanted to hear.
Yes, okay. Anna, you had something to say.
No, it's more just taking advantage that Mia is connected as well. Mia, you've been to Lesbos. You're a clinical psychologist, and I don't know how what your impression was or what you were working with in Lesbos, but can you just comment on the effect that you see on patients from being stranded the way they are?
Well, I was there the week after the fire, I would say, and I went down there for just a week to support the staff. So that was my position. And yeah, during that week, things were crazy. I mean, people were in the streets. They were not in the new camp yet. And morale was going down a lot. People were very exhausted after spending days on the streets. So I wouldn't be able to say how things are now, but that's, I mean, the situation was at its extremist, I would say, at that point, because yeah, they were out of any place to stay. I don't know what else I can add, but yeah.
I'm also thinking from perspective of working with refugee integration, migration issues in Sweden. When and if some of these people will resettle to Sweden, this will most likely be a cause of their trauma. So, I mean, this be from Greece to set an agenda or to show that refugees are not welcome, but the damage is being done in the long run is probably worse than most people can imagine, and in order for these people to actually be able to go on with their lives.
Yeah,
it just adds to the previous trauma.
Yeah,
yes.
Trauma after trauma after trauma. Yeah.
So we have about 5 minutes left of this meeting time. I would like to hand over to Peter, as I have to exit the meeting now. So Peter, would you like to take the mic, and I can take the opportunity to say goodbye?
Thank you so much, Jenny.
Thank you very much, Jenny, for very fine moderating. I'm very happy that you could join, especially, yes, with your skills and your background. It's very, very
Thank you very much. Thank you.
Thanks.
Thank you.
Okay, so I see two new questions. Afamia, you have your hands up, and then Anna-Lena.
Yes, actually, it was just a comment or reflection on what the last part here, and on your reflection on why it seems so desperate in Moria. I have not been to Moria, but I was in a refugee camp in Bulgaria in 2015, where mainly Syrians were, and I'm half Syrian myself. So I got to connect with some people there, and the impression was people there were also actually very desperate, although they were in a way like they came from a pretty good background, most of them, and they had not most of them had not had very severe traumas in Syria, but they were very, very desperate. And what some told me were like, is it like this in Europe? Like, as we have other expectations, thinking that we are a little bit better in Europe than any other country in handling people in humanity. So I think they were also, many of them, very, very disappointed with the situation they were put in Bulgaria. They were like not allowed to go out. They were not served food. They were living in tents, although it was like minus degrees, and like things like really basic things, but they were actually expecting more from a European country. So I think that is part of that of the explanation. I think, although it seemed that the situation in Moria is much, much worse compared to what I saw there in Hermanli in Bulgaria. But I think people thought more of Europe and they got very, very disappointed, I would say.
Yeah, thank you for that comment. I mean, it's very shameful that we have this within Europe and that it's still ongoing. I think as an organization, yeah, we can do what we can to raise this issue. I think, but yes, you don't get much hope from hearing the political difficulties from this, of course. So unless there are any more questions or comments, then I would like to wrap this up. Just short. I hope you feel a wow on the ambition and purpose statement, and if not, please write to me or Anna. And apart from that, I would like to thank our participants very much. Now it's only you, Anna-Lena, left, but thank you very much for your very strong testimony and giving us a very good picture of the situation there, with picture that I haven't really gotten before. So thank you very much for that. Thank you very much, Tina, as well, for your input on the current situation and for all the questions and for the discussion. So I hope we see each other soon again at some point. And if there's anything, just let us know. And thank you, Anna, as well.
Thank you.
Thank you very much. Take care, everybody.
Thank you all.
Thanks. It was super interesting. Thank you.
Good night.
Good night.